I make sure to gather all of my equipment for central line dressing change. I clean my table. Okay, I'm gonna clean my workspace. And clean all that. Then I'm gonna throw it in the trash. Okay. I'm going to clean my hands, introduce myself to my patient. My name is Elizabeth. I'm here to do a dressing change on your central line. And I ask the patient for their identifiers. I make sure I have the right patient. Okay. Provide some privacy. So with my equipment, I put a mask on them, and I ask them to look that way. I'll teach them to look that way during the dressing change. And then I'll put a mask on myself. Okay. I'll put gloves on. Okay, I'll throw that away and take my gloves off. And I'm going to assess the site. So I'm going to put on my sterile gloves. Let me scoop this one. Okay. Remove that out of my way. I'm gonna get a chlorhexidine wipe and I'm gonna crack it. And I'm just gonna clean real good for 30 seconds. It's been 30 seconds. Letting it dry for about 30 seconds. Then I'll put one of the markers on, bio patch. And then I'll put the dressing on. Okay. Then I'm going to use this tape. So I'll put that right on the dressing. And I'll put the date, time, my initials, and the catheter size. And I'll clean up my supplies. And I'll wash my hands. And I'll document everything. And I'll make sure that the patient is low in their bed with their call light. Before I enter the patient's room, I'm gonna make sure I have the correct blood order for this patient. I'm gonna knock. I'm gonna come in and introduce myself, make sure I have all my supplies, and clean my surface. There we go. So I'm gonna clean my surfaces. I'm gonna make sure I have the right patient. Can you verify your name and date of birth for me? They do, I have the right patient. I'm gonna provide privacy. Okay, and explain the procedure. So today, I'm going to do a blood draw from your distal central line. Gonna clean my hands. So if they had an infusion running, I would stop the infusion beforehand. And then I'm gonna position my patient. They're in a good position. I'm gonna put some gloves on. Okay. So I'll stop the infusion. Now I come over here and clean the hub of the lumens for 30 seconds with an antiseptic wipe. So I'm cleaning for 30 seconds and then I'm letting it dry all the way. And then I'm gonna get 10 milliliters of normal saline. I'm going to unclamp it. And I'm going to flush the whole 10 milliliters. And then I'm going to draw back. Okay, and then I'm going to waste that. Then I have my vacuum tube here. I'm going to connect that. Okay, and then I got my sample. And take that off, and I would put that in sharps. And then flush it with 10 more milliliters of normal saline using a positive pulse pressure. And then clamp it. And then if they had an infusion running, I would start the infusion again. But they don't. And I put an antiseptic cap on it. And then I'm going to take my tubing, and I'm going to put the patient's label on it. And I'm going to put it in the biohazard container. I'm going take my gloves off. Wash my hands. I'm going to clean up all my supplies. Now I put them in the trash. And I would make sure that the patient's bed is in the low position, that they have their call light, and I'll take the sample to the lab.